A state of public health emergency declared in Alberta. Good evening, I'm Tara Overholt. Governments here and across Canada ramping up their efforts to stop the spread of COVID-19. 23 new cases have been confirmed in Alberta, bringing the total to 97. 5 people remain in hospital, the same as yesterday. 2 are in ICU. We're going to have more on what this means for our healthcare system from the Alberta Chief Medical Officer of Health in just a moment. But first, Alberta's Premier on what that state of emergency means and how it will change your daily life.
Any organized gathering of more than 50 people are to be cancelled immediately. All Albertans are prohibited from attending public recreational facilities and private entertainment facilities such as casinos, bingo halls, bars, theaters, and children's play centers until further notice. They are also prohibited from attending recreational facilities, arenas, science centers, museums, art galleries, and community centers, fitness centers, and entertainment facilities.
So mass gatherings, including funerals and weddings, are limited to no more than 50 people. Sit-down restaurants, pubs, and coffee shops are allowed to stay open as long as they do not have more than 50 people inside or 50% of their authorized capacity, whichever is lower. Essential places like grocery stores, airports, healthcare centers will remain open, as well as homeless shelters and nonprofit soup kitchens. As well, the province is also giving $60 million to cities, charities, and nonprofit groups providing social supports. Meanwhile, Alberta's top doctors saying the aggressive measures announced by the province will help flatten the curve and reduce the spread of the virus, especially since so far 6 cases could be community transmission. Dr. Dina Hinshaw says our healthcare system needs room to deal with what will inevitably be a rising number of cases.
The healthcare system is preparing for any increase in the number of cases that need hospital care. Alberta Health Services is postponing all scheduled and elective surgeries. Urgent and emergency surgery, as well as oncology and scheduled cesarean procedures, will continue. AHS will be contacting Albertans scheduled for procedures and will reschedule as soon as possible. We do not have a timeline for this due to the ongoing pandemic.